This short introduction to the Johnson & Johnson vaccine aims to equip you as healthcare workers with your decision to take up the offer of vaccination through the JnJ program and outlines the steps to follow to access the vaccine. It's been a brutal start to 2021. On the front line have been our health workers, who are 3 to 4 times more likely than the general population to develop COVID. With a third wave likely this winter, we need to move quickly to protect our health workers. Plans to roll out widespread vaccination were at an advanced stage when the vaccine landscape changed, with news that the Oxford AstraZeneca or COVID-Shield vaccine was less effective than hoped against the 501YV2 variant that spread rapidly during the second wave. Fortunately, other research showed that the single-dose Johnson & Johnson vaccine was effective against the new variant, could also be stored at fridge temperatures for a period, and only required a single dose, making it an excellent first choice for South Africa's vaccination program. The trial that tested the single dose of the Johnson & Johnson vaccine is called Ensemble and enrolled almost 44,000 people from 4 continents, including just over 6,500 people from South Africa. Ensemble showed that while the vaccine does not prevent mild symptoms, it does provide good protection against moderate to severe disease, excellent protection against severe disease, and complete protection against death. There were no deaths among people who received the vaccine, although a small number of people who did not receive the vaccine died from COVID. There were no safety concerns noted in the trial. There have also been no safety concerns in trials or vaccination campaigns of this particular type of vaccine when used against other diseases such as Ebola or Zika. The only downside is that it is not yet licensed. Rolling applications are underway in the US, Europe, and South Africa. It is important to emphasize that the fact that it is not yet licensed does not mean that it is not safe or efficacious. JnJ is a partnership between government and the Medical Research Council that allows us to make the safe and effective vaccine immediately available to health workers through a research program. JnJ is not the same as the usual clinical trial, but rather a way that research can help to make the vaccine available while the licensing process takes place. Usually, vaccines pass through the licensing process without being made available. But with the third wave likely, we simply cannot afford to wait. The South African Health Products Regulatory Authority has approved the use of the Johnson & Johnson vaccine in this way while it processes the full licensing. The JnJ program has secured sufficient doses of the Johnson & Johnson vaccine for the first 500,000 of the country's 1.25 million health workers. The first batch of 80,000 doses arrived on the 16th of February, and further deliveries will follow every 2 weeks. Vaccines are initially being made available at 18 hospitals throughout the country, where teams of researchers and vaccinators are working together to deliver the vaccine to health workers up to 10 hours a day, 7 days a week. More vaccination centers will be added in the coming weeks. If you are a health worker, you are eligible to apply for early access to the COVID-19 vaccine. You must apply using the National Department of Health Electronic Vaccination Data System. It is the responsibility of the individual health worker to ensure that they are registered on the system. No vaccine will be provided unless you have registered. Registration involves 6 steps. First, register on the National Department of Health